You've decided you're ready to become a parent, and suddenly you're overwhelmed with people who feel they have the right to inform you on the correct way to conceive, give birth, what fears you should have, and the proper way to parent. How do you filter through the opinions? How do you know what's trustworthy information and what's a myth or just plain outdated? Welcome to the Birth Ease podcast. Join your host Michelle Smith and her guests as they cut through the noise and fear by sharing valuable tips, tools, and proven methods that help you connect with your own inner wisdom as you navigate the sacred journey that is pregnancy, birth, and parenthood in a more relaxed and confident manner. This podcast does not constitute, nor is it intended, as medical advice.
Hello, Birth Ease families. Welcome to this heartfelt space. I'm your host, Michelle Smith. My intention throughout this podcast has been to provide you with resources and tools to be able to mitigate stress and strain and overload that can often happen during pregnancy, birth, and parenthood. I am so honored and excited to have with me Annette Leary. Annette has her Bachelor's of Science in Nursing, and in fact, she's been working with families for over 30 years. As a pediatric postpartum nurse and internationally board-certified lactation consultant. Annette enjoys working with the whole family to improve their state of wellness and to educate them on how to seek knowledge on managing their health. Annette is Upledger trained in CranioSacral Therapy, and today that is the modality that we are going to be exploring. She's going to share about the benefits of CranioSacral Therapy, what it is, the impacts it can have for families and babies, and the ways that it can help reduce tension, restrictions, and even trauma within the body. Welcome, Annette. I'm so excited to have you here today with me.
Thank you. Thank you for inviting me. It's my pleasure to be here with you, and I feel very honored that you asked me to be here today.
Oh, you're very welcome. You're very welcome. I am so excited that we're going to be sharing about CranioSacral Therapy.
I am really happy. CranioSacral Therapy first came to me over, about 25 years ago when I lived in Boston. I was a young nurse and I would see this doctor go through the nursery. He was assessing the babies and he was a DO. And I would say, oh, what is he doing? The babies just seem to calm down as soon as he gets over and touches them. And then the moms would say, oh, the baby's eating so much better and nursing so much better. So at that time, I didn't understand what it was. I wish I knew then what I know now, because I think it would have been really helpful for my own babies when I was a young mother. And then when I moved to Florida, I met this wonderful woman. She's a physical therapist named Claudia Silva. And she introduced herself to me, told me about CranioSacral Therapy. And I said, yes, that would be so great. I think it's a modality that would really help moms and babies connect and heal from whatever's going on and help organize feeding states and help organize parenting states. And so we worked together and I would tell the moms to go and meet her. And then it got to a point where I knew she was really busy doing a lot of the trainings. She's a craniosacral therapist and she's a trainer, a diplomat. And she was getting busier where the moms couldn't get appointments with her. And I said, well, is there anything I can learn? Just one thing to help the moms calm down or help them reconnect with their babies until you can work with them. And that's where my story blossomed and began with this craniosacral work. As a nurse for over 32 years and a lactation consultant over 25 years, I felt there was still a piece missing in helping these families latch on to parenting, latch on to feeding their babies and nourishing their babies. And people will say to me, well, do you only work on babies? I said, oh, no, I work on, from hours old to really, I've worked with people during hospice.
Wow. And
helped their families release their families to the next level. And I truly believe once I showed them, put a hand here, put a hand there, talk to them, tell them it's okay. When the patient was struggling to take their last breath, they finally let it go when they placed their hands in the thoracic outlet, in the avenue of expression, that we call it. And it's pretty powerful when you see that happen. So yeah, it's been a wonderful journey. I've been on the last 6 years, taking many classes. I always feel I am the lucky one to be called on by families. They will reach out to me, a friend of a friend, or maybe someone on Facebook told them about me, or it always surprises me. I'll get a phone call from someone visiting from the Bahamas. Oh, you work with my friends that live in the Bahamas, and they told me to call you. You would help us. But as I was saying, I always feel very blessed to get those opportunities and be in those people's lives and being asked to be a part of this very intimate, vulnerable time in their lives.
Yes. And I love that you shared how it could help in the transition from living to dying. I can see how this modality could really help a family, could help ease that transition, whether it's leaving this life or entering into it as a new baby. So can you please share with the Birthies families what CranioSacral Therapy is?
Wow,
it's hard to explain. I know.
It is, but it is great. It's one of those things you have to experience, and even when you experience it, you come off the table saying, what just happened? I've had people say, I feel like my right half is meeting my left half. I feel more balanced. I feel very relaxed. I feel complete. Those are different things that they say. But CranioSacral Therapy is a very gentle, hands-on method of evaluating and enhancing the functioning of the physiological body system called the craniosacral system. A lot of words there. So I'm going to shorten it. When I say CST, I'm referring to craniosacral therapy. It's kind of the pet name we use for craniosacral therapy. It's just less of a mouthful. It was developed by a Dr. John E. Upledger in the 1970s, as I said, as a gentle hands-on approach that works through our craniosacral system, alleviates a range of disorders to improve health, to diminish pain, anxiety, helps bring the anxiety down, depression. There's so many numerous things it can help with. And the lovely thing is it's extremely non-invasive. And that was really important to me. I got to a point in my life, my youngest was graduating high school, and I said, okay, what's next for me? I'm an RN. Do I go back to school and become a nurse practitioner? If I become a nurse practitioner, will I really be able to practice in the most holistic way? And a lot of my friends who became a nurse practitioner, they aren't able to, even now, work in the field that they want to work in. So at that time in my life, this craniosacral therapy opportunity came, and they were doing an intro class. And so I took the intro class. It was 2 days. They taught us 6 techniques. And I said, okay, great. This is fun. I'm going to go home and practice on my family, right? Aren't we lucky our families get...
Right.
Our families always get to be our little guinea pigs. And, of course, the 16-year-old son said, no, I don't feel anything. My husband, who's wonderful, we've been together for over 34 years, and he just thinks anything I do. And it also, what he enjoyed most is that just my hands were all over his body, right?
Right.
And going to different parts of his body, a very gentle touch. And the most impactful one was my daughter. She was in her early 20s and has suffered with a lot of anxiety, a lot of sleep disorders. We've tried to figure out what's going on. And when I worked on her, I did just the 6 of the 10 steps that they teach you in the intro class. And again, as the moons aligned and the stars aligned and everything aligned, I was just very fortunate that 6 weeks later, they were going to do a full 4-day CST class. And my daughter texted me the morning I woke up to take the full 4-day CST 1 course. And she said, Mom, I don't know what you did to me 6 weeks ago, but please do that again. I was sleeping so much better. I was feeling more balanced, mind, body, and soul. I need it again. Please. When can you do that?
And that's significant if your children ask you to do it.
Right.
It's usually like, oh, Mom, stop.
It was very positive, powerful affirmation for me to say, yes, Annette, you're going in the right direction. Follow that. You were torn between whether going back to traditional university, Masters of Science in Nursing versus more holistic training.
Well, I have to say I was very excited when I heard that you were training in it because, again, I've known about this modality, my gosh, probably 20 years now, and it is life-changing.
Yeah, it is. We're even noticing now that we can, the courses that I have fortunate enough to take, as I said, they're 4-day trainings. And usually when I do a 4-day training, I really immerse myself. Again, the moon, the stars, everything aligns for these families to find me after I come out of a childbirth training. There's one when I took CranioSacral Therapy for conception, pregnancy, and birthing.
Oh, wow.
So even going to the point of conception and working on the body and working on the DNA, and I have to believe it's no coincidence. One of my younger cousins was, working on trying to start a family and was working really hard on that. And I said, let me just try. Let me just work on you. It doesn't hurt. It's a very gentle. We don't use more than 5 grams of touch on an adult, and you don't use more than 1 gram of touch on a baby. With a baby, a lot of times it's just more intention than really touching. But anyway, I worked with her. I felt something going on because we are trained with the conception, pregnancy, and childbirth how to work with the hormone levels and activate the ovaries. And it was not just her, it was probably about 4 others that I worked on at the same time that were getting ready to start families. And they had been, trying for a little bit, and they all got pregnant. And I can't say that I did that, but I helped her body facilitate whatever healing process, their bodies helped facilitate any healing processes that needed to go on so that could happen, is what I really believe.
Yeah, I didn't realize that craniosacral could help with hormonal levels and fertility. That's huge. I'm sitting here taking that in, the impact of preparing the body, because I know hypnosis can help with fertility, especially if it's unexplained. Like, what are the emotional blocks that somebody could be holding? And acupuncture is always beneficial. But the bit that I do understand about craniosacral therapy, it makes so much sense that it would and could be beneficial when you're wanting to conceive.
Yes, it was really cool. The last couple of trainings I've had have been in the conception, birth, pregnancy, and birthing 1 and 2. We learned how to palpate hormones.
Wow.
An estrogen hormone feels like one of those, when the milkweeds, when the daisy turns into the weed and you can blow it. And
The dandelions?
Yes, the dandelions. That's what I'm thinking of, the dandelions. Yes, the milkweeds, and you blow them. That's what an estrogen feels like to me. And a lactating mom, I can feel her pituitary and work on the prolactin uptake and feel if there's too much estrogen or too much progesterone or testosterone going on.
Wow.
So it's pretty powerful. And not only as we were saying with the trainings, it's not only from the point of conception, we can even go back and do our own birth stories. We actually got to go into these. They were these nylon kind of knit socks, almost like you were back in your placenta. And recreated our own births. And that has helped some people with whatever restrictions they have in life, whatever is keeping them stuck from moving to the next phase that they need, whether it's emotionally, whether it's professionally, whether it's physically. It's pretty amazing to see those results.
Right, because babies are aware in the womb and they can feel it. That was in the episode Susan DeCincy and I were talking about that, how babies are aware in the womb and they can feel if they're wanted, if they're not. They interpret their mother's stress often as their own. So if we can have ways to release it.
Absolutely. You are 100% on with that. That is some of the work we do when doing craniosacral therapy on a pregnant person. You feel the craniosacral rhythm of the baby or babies. It's really cool. I've had a couple of twins and then feeling and working on the mom post-delivery and feeling like, wow, your body feels so different. There's 2 less craniosacral rhythms here. But a lot of the work I do is really getting them to start talking to their babies more. And we've seen things like placentas move. Talk to the baby, talk to your body, talk to the placenta. We call it our inner physician or the inner wisdom that everyone has. And that is something when I work with someone, when I really tried to have them learn how to connect with their inner physician, their inner wisdom, and find out what's going on. Let's talk about, where have you felt this before? What does it feel like to you? Talk to your body. Let's see. And when it comes to the pregnancy, I've had very successful situations where I say, talk to the baby. Tell the baby you want the baby to go head down. Yes, you can play headphones down there. Yes, you can do all these maneuvers. But have you really explained to the baby why it's so important and why the baby would benefit so much better from being head down and going for vaginal delivery? And this is a funny story. One of my clients, it was her second baby, and she had some medical stuff going on where a C-section was not, no one really wants a C-section, right? It's a cesarean birth. No one wants to go through that. But for her, with her medical issues going on, they were going to have to put her under anesthesia where she would be asleep and not awake, not with an epidural. And she was terrified of that. She didn't want that to happen. And I said, you really need to talk to this baby and explain to her why this makes you concerned and why you're concerned for her and her health outcome. And it sounds kooky, it sounds crazy, but I really, as I was working on her body, I said, she's a funny little one. She's got her hands on her hip and saying, I'll do this when I'm ready, because we both were talking to her. And do you know, Mom was prepped and getting ready to go into the operating room. And she said, please just check one more time. I just felt something. And she turned herself head down, and that mother had a beautiful vaginal birth like she'd wanted to. But I really swear this baby just stood there and said, it's on my time, but I get it. I understand and I'll do it, but don't rush me.
Oh my gosh. Yes. You're speaking my language so much. Yeah. Because I've helped to facilitate the space for moms to talk to their babies, and they listen to the guided relaxation sessions, or we do a session in person and talk to the baby and help the body relax to help the baby move down. And of course, I like to pull in chiropractic and acupuncture to help turn the baby.
Reflexology.
Yes. But now I have another tool too, CranioSacral. But it's the babies are aware. And I've had some that, they're like, I'll do it when I'm ready. Or they know and they won't turn. Because
I can't, the cord's here, or there's a knot, or it's just not going to work. I'd like to help you, Mom, but I can't. Yeah, exactly. Yeah,
it's amazing stuff. And we probably do sound a little kooky to some, but you know what you know. When you've experienced it and you felt it and you see what happens, it's incredible.
And this is part of myself evolving as I work with families of all ages and learning to trust what I'm feeling and getting that affirmation from, whether it be the child, the baby, the mother, whoever it is I'm working on. I felt something and you're almost afraid to say it. And then they're like, no, this is what's going on. This, why is my right knee twitching, or whatever is going on. I do also find I want to talk a little bit more about talking to the babies through the CranioSacral Therapy. I don't know if you've experienced this. I'm sure you have. When it's the second, third, fourth, fifth baby, sometimes the moms are so busy taking care of the house and the other children that they haven't really connected with this baby yet. And through this work with the CranioSacral Therapy in pregnancy, that's where I get the mother to say, even if it's just 10 minutes, let the baby know that you're there and you want to listen to them and have that conversation of what you hope for them and what you hope for the birth and what you're dreaming about or wish for.
Yeah, it's powerful. It's powerful. William Emerson talks about creating that healing relational field and how that can help reduce trauma that moms and babies experience, and the impact of the trauma that they might be experiencing is lessened when that bond is there and when that bond is strong.
Yeah, exactly. I've had situations where the mom wasn't sure why the baby was so fussy, or why does the baby keep their hands up high around their neck. And one time I was working on a baby, and 3 times he grabbed his shirt collar and pulled away, and grabbed it and pulled away, and grabbed it and pulled away. And do you know what that baby was telling me? Nuchal cord times 3. and what he felt in the womb as he was trying to make his entrance. And when I explained that to the mom, so when you work with a baby, you're really working with the whole family. Right. And the mom. And for me, not only am I doing the craniosacral techniques on the baby, if mom has to feed the baby, I get the mom up on the table. Anyone that doesn't, and you probably know this because you do a lot of healing and spiritual work and energy work, it is so important to include the family. I really love it if the partner can be there too. Sometimes I'll be working on the baby and then the baby needs to eat. So I put mom on the table and I start working on her diaphragms. With craniosacral therapy, there are diaphragms that we say a release. And I'll talk a little bit more about that. We can go back to that in a bit. And then if the dad comes over or the partner comes over and they have their hand on mom's leg, or I've had situations where mom's laying down on the table and I say, this baby really needs a sip. Can we feed this baby right now? It's okay. And the partner comes over and holds the baby in place. And now they're touching mom and they're touching the baby and mom's touching the baby. That energy field there, powerful. Mm-hmm. And when that whole family leaves and there's a sense of balance to them, they feel it. They text me like, thank you. This almost felt like therapy, like right. Couples counseling.
Right. So can you delve a little bit more into what craniosacral therapy is, how it can benefit moms, babies?
So there's the mother aspect of what it can help, and then there's the baby aspect. Mm-hmm. So let's first talk about what is, craniosacral therapy. Sometimes that word can sound scary, like, what are you going to do? You're going to twist the bones? Again, I start off, when I started doing this, being an RN and a nurse, I was really careful to find something, no one wants to do any harm, but for me, that was really critical. Mm-hmm. If I'm going to touch someone and work with their soft tissue and their bones, are you sure I can't hurt them? It's osteopathic in nature. I explain it, it's kind of getting the kinks out of the nervous system. When we think of the big, beautiful brain we have connected to our spinal cord and the layers around the spinal cord, the dural tube, and all what the cranial nerves leave our brain and leave out of the occiput at the bottom of our head and go to all the areas that it needs to, working on your arm, helping your stomach function. There's the 12 cranial nerves and being able to tune into them. Today I was helping my coworker with her rib pain, and accessory nerve kept coming to me, accessory nerve. So I just stayed in that spot and she could feel some relief of the pain there. So anyway, it's working, getting the kinks out of the central nervous system so that the rest of the body can function. And with getting those kinks out, we sometimes use the words release. You can release many things. You can release tissue. You can release emotions. Sometimes there are energy cysts. The other way I love to explain craniosacral therapy, it's like, think about an onion and peeling back the layers of the physical and emotional trauma our bodies have been through. It can go as far back as falling down, skinning your knee as a 3-year-old. Maybe, depending on what our upbringing was, maybe someone saying, don't cry, you don't need to cry over that. To being coddled and oh, it's okay, we're going to make it better. Any of those things that make someone maybe feel stuck or restricted. And sometimes when I'm working on someone, they lay on it. You stay clothed. People walk in and they want to start taking their clothes off. I'm like, no, thank you. Keep them on. And you lay. I can do it in a chair. I do love putting someone on a massage table because I think they can relax and their spine and their dural tube can open up a little bit more. But I can certainly do it in a chair. I've worked on people that were in the hospital, in their hospital bed. Wherever I need to work on someone, I can adapt to their environment. But you lay on the table and there is a basic 10-step protocol where we put our hands in the front and the back of the body. Again, 5 grams is the weight of a nickel. Pick up a nickel right now and put it on your palm or just try to balance it on a finger. That is the amount that the touch is on an adult. With a baby or a child, we use 1 gram to just intent. So it almost doesn't even feel like you're touching. Mm-hmm. And it is so important when working with someone that is going to do craniosacral techniques on you, your family, your baby. You want to make sure that they're well trained. I have had situations now, as many, that's why I'm very proud that I've been able to go through the Upledger Institute that takes 4 days of a training session before we're complete in understanding that modality in that area. Whether it's Pediatrics 1 and Pediatrics 2, and then from there we go forward and start practicing. I've had situations where people say, oh yeah, I took a weekend course on craniosacral therapy and I can work on babies now. Mm-hmm. I'm like, wait, I had to do CST1, CST2, SCR, somato-emotional release before I could even get into the PEDS course. Right. And I am someone that's been a pediatric nurse. That's my first love. I was working with children in the late 80s, and then went over to the childbirth world, working in a hospital postpartum unit, a LDRP unit, and a special care nursery unit. So I've had that experience working around them, and I myself was not comfortable doing techniques on a baby until I had done all of the training I needed to do. So I would say that find out what their training is, find out if they've taken all of the courses, not just a weekend course that says, hey, okay, good, you've learned the techniques, go forth and have fun, Right. That scares me sometimes.
Right.
So you lay on the table if you can, or wherever you're sitting, and my hands go, as I said, from your sacrum to your cranium, basically. And with children, until they're 8 or 9 years old, you are not trained, or you should not be doing any compressions. It's always decompression. So I know that compression, decompression can sound scary. Think about it again. It's with 1 gram to 5 grams a touch. So it's very, very gentle with releasing bones. And mostly I'm talking about with the cranium, with the head.
Which I think, too, after birth, that can be really important because their poor little heads can get molding and caput. And
Or
the cone head would be the more common word, right?
Yeah. Well, today I had a baby that came in, and I had just met the mom, and it was her follow-up appointment when she had seen someone else and came to see me. And I said, as I felt the back of this baby's head, which felt very flat, I said, can you tell me about his birth and where was he positioned inside? She's like, oh, he was OP. I said, okay, that would explain why the back of his head is feeling very flat, and he's 6 weeks old. This is what we're going to do now to kind of help facilitate that. So it's more than just what I do. I try to show families and parents things that they can do with the baby to help their babies with eating better, whether it's gentle stretches in the mouth, releasing hyoid muscles under the tongue with a very gentle touch, teaching them something called guppy time. Have you heard of tummy time methods with Michelle Emmanuel? She teaches a tummy time method technique, and I've learned through her about something called guppy time. Guppy time, if anyone's taken yoga, if you know the position fish in yoga, where you lay on your back and you put a little block behind your neck, and so that your head can fall back, your jaw can release and open up wider. We gently do that with babies over our lap so their little heads can go back. It's almost like a reverse tummy time. And how the tummy time can help the babies also get these heads molded a little bit better, because we're all about back to sleep. Right. That's fine. And getting the babies out of the buckets, that's a big one. Getting them out of their bucket seats so they're not laying flat on their back the whole time, and letting them do a little baby yoga called guppy, or a little tummy time with their arms forward and kind of a Superman pose. Really is very simple things they can do with their baby. And as I said, when I work with a family, I try to teach them things they can do with the babies. And as I work, I have children that I work with as well. The craniosacral therapy, as we talked about, of the baby and children under the age of 8, it's all about releasing and just gently putting your hands different places. My favorite little ones to work with are 2-year-olds, because they are so perceptive of that touch. They'll look at me and pull my hand away and say, no. And I just wait, and then I'll try to go somewhere else. Hot, don't. because I think my hands must get hot for them.
Right.
Adults have told me it feels like there's a heating pad on. I don't feel it when I'm working on someone. I don't feel that heat coming from my hands, but I've heard that it feels comforting. It feels like a heating pad's on their lower back or underneath their head. But when the 2-year-old tells you that, it is funny. And with children, they don't have to lay on the table. I am on the floor with them. We're having a tea party and I'm sitting behind them and working on their different parts of their bodies, their different diaphragms. We start at the sacrum and we can go to their abdominal, to their thoracic area, the back of their head, their frontal bone, just kind of gently touching there and getting the fluid. What we're trying to do is get those kinks out, get that craniosacral fluid flowing through the sutures, through cranial nerves, so that they can have optimal function of organs, of feeding state, development. I've worked with some children that have Down syndrome or developmental delays. And one of my favorite stories is a little one that mom came in and said, oh, we've been going to OT, we've been going to PT, we've been going to speech therapy, and he just can't move an object from right hand to left hand. That's the next developmental milestone we want to reach. His peers who are 6 months, 7 months are doing that, but he can't do it, and he's 11 months old. In the middle of the therapy, doesn't he move a ball from one hand to the other and back and forth as mom is expressing? So you see how powerful it is. Mom was giving the release verbally of what she was wanting for her child, and the child showed her, I can do it. Look it. Here you go. I'll do it. If that makes you happy, here you go. And this same little guy, fast forward another 6 months, and I said, how's his communication and his speech and language coming along? Oh, we've been working on sign language, and he's just not getting it. But I said, okay. All of a sudden, she's like, wait, stop. He's signing he wants a cracker. I said, well, then go get him a cracker. He deserves a cracker. She's like, no, this is unreal. We've been working on sign language for the last couple of months, and now he's signing he wants a cracker. So it is pretty powerful what goes on in there. As far as other craniosacral techniques with adults and even with children, we go into the mouth and can work on the maxilla and softening the upper lip so the lips can flange better for latching, synchronize the vomer bone with the sphenoid bone. It sounds all really technical. It's a very gentle movement, but to get that organization of suck, swallow, breathe and feeding state so that the babies can organize their feeding state a little bit better. I've had 4-year-olds. Mom says, oh, he gags all the time whenever he eats. And we're always cleaning up messes because he makes himself throw up. 2 sessions, the gag went away because we worked on the vagal nerve, the phrenic nerve. We worked on all the nerves that needed to be worked on in the vomer bone. And he was doing so much better.
Wow. I knew you could do a lot with craniosacral therapy, but is this really blowing my mind? In a good way. So it sounds like it would be good to do routinely in pregnancy, even before you became pregnant, working with your little ones or newborns. But are there any signs that maybe a parent could look for that would indicate that craniosacral therapy could really be beneficial to the child?
So let's start with the pregnancy. Different things going on with the women that I've worked with during pregnancy. Severe anxiety. Helping them deal with that anxiety of growing a life and just life in general, helping them with their anxiety. Yes, pregnancy, aches and pains, a lot of sciatic pain, nerve pain. Again, what's the sciatic? A nerve, right?
Right.
Let's work on that tissue, doing a little bit of fascial release. Again, remember, it's always extremely gentle. There are times I can have one hand on the sacrum and one hand just above the pubic bone. And all of a sudden, the person will say, oh, my nose, it's running. Why is my nose running? Or we haven't even touched, as we were talking about earlier, the peeling away the onion, right? Getting to the emotional. Sometimes I'll have my hands there and they'll remember all of a sudden their pregnant sciatic pain, whatever's going on, maybe not pregnant. And they'll say to me, oh, when I was 12, I was riding a bike and out of the blue, I fell off the bike, hit the handlebars, bumped my head and landed on my tuchus and it hurt so bad. And do you see what that is? That memory of that tissue held on to. And once they verbalize it and get it out, it's amazing.
Yes, I really feel, I'm interrupting your story a little bit, but our bodies remember.
Yeah.
They remember. And just like we want to verbalize and be heard, so do our bodies.
Mm-hmm.
And when we can create that space to listen to the wisdom that our body is wanting to share with us, so we can return to balance, then that's where healing can occur, I think.
Absolutely. You're absolutely right. Yeah.
So we discussed where it could be beneficial in pregnancy. Where would it be beneficial for a baby? What signs to look for?
Very good. One of the intake questions I do as a lactation consultant is I ask how the birth was. Was it long? Were you induced for several days maybe? Was it prodromal? Did you push? Usually if I know that they were in a second stage of labor for longer than 2 hours, really actively pushing, 3 hours, 4 hours, vacuum extraction, forceps extraction. I'm hearing about cesarean births with vacuum extraction.
Oh, wow.
Yes. Once I hear that, that just tells you all of that pressure, right? And those cranial nerves being compressed or pulled. That's one situation, depending on what the birth's like. Sometimes they don't even realize that maybe it was an easy birth. Maybe it was a beautiful birth. My mantra as a lactation consultant is mammals are born to breastfeed. And when this beautiful human mammal is really having a difficult time organizing their suck, swallow, breathe, where their tongue is going, how wide to open their mouth and accept what is most natural, their mother's nipple. Do we get a dog a lactation consultant? Do we get a cat a lactation?
Right.
No, they just know what to do, right? Mammals are born to breastfeed. And when our human baby mammals are having a difficult time with any of their biological states, organizing them, eating, eliminating,
yes,
irritability, gassiness, digestion, colic, yes.
Yes.
Those kind of things. Sometimes it relates back to the birth. They didn't even think about, oh yeah, the baby was in this position for so long inside of me, or it was transverse most of the pregnancy, or stuck under my ribs, or who knows, right? We pushed for very long, or they did use vacuum, or not even any of that, just something's going on. So for newborns, those are the kind of things we look at. Digestion, feeding, being able to self-soothe, being able to sleep, really disruptive sleep patterns with the babies. I'll also see situations where, maybe the baby's a week or two old and I'll hear, oh, he's so strong, he's standing up. Babies aren't supposed to stand up at 2 weeks or arch their head back. I had one baby who was 6 months old and I'm friends with them, and I was watching the pictures that they kept posting on social media. And I finally reached out through a text and I said, hey, how are things going? What's going on with the baby? Because, of course, we always try to put on social media our happy stuff.
Right.
But I noticed that this baby looked like a crunched up little butterball. He was beautiful. He was chunky. He would smile, but he looked so stiff where he was. And that's when she said, yeah, we just figured it's because he's so fat, he can't roll over. We thought he was so chunky that he can't sit up. And it was one session of doing some craniosacral work, just releasing his pelvic, just putting my hands in the front and back in a very gentle way and letting his tissue. Our bodies are designed to heal, as we talked about earlier. Our inner physician, our inner wisdom wants to facilitate that healing process, right?
Mm-hmm.
So with that baby, one session, and she's like, oh my goodness, he's rolling. It's not because he's too chunky. He can roll. So there's those situations. And then once I work with a family, work with a baby and a mom, it is funny. My clients, I love them. They'll say, oh, Dad said I need to bring the baby back. Oh, Dad did? Why? Because she's screaming, or she's arching her head back, or she's stiff and we can't get her in the car seat easily. So you're looking at not only things that babies are supposed to do. Human mammals are born to breastfeed. Babies should be able to eat at the breast and organize their feeding state. Is there something tight in the mouth? Is there something restricting them from being able to do that? They can't self-soothe. They can't reach a developmental milestone. Also, there may be some plagiocephaly going on. That's that flattening of the head.
Right.
Maybe some torticollis. Again, could it be related to position in womb? Who knows? Or just that one side is tighter than the other and they're always cocked to one side and they tend to roll over onto that side. So, things like that. Torticollis with newborns, colic reflux. Oh gosh, I'm trying to think of the numerous things we work on. Many families have recently, when they choose to do vaccines or on a vaccine schedule, they make an appointment vaccine day because CST, as it's pumping the fluid through the craniosacral system, helps chelate out what doesn't need to be there, any of the toxins that they're worried about.
Oh, that makes so much sense.
And I've worked with families in young children, unfortunately, that have had to have chemotherapy, have come to see me after their last dose of chemo in that round, and it helped with brain fog. So many times it is either when the person's able to talk. I've had children that will say, can you bring me to Miss Annette? I'm just feeling what I was feeling before. Because I work with many children, some without being on a spectrum of any sort, but with sensory or Asperger's or autism. And once they're able to verbalize, or children with Down syndrome, they're able to say, I don't feel right. Can you bring me to Miss Annette again?
Wow.
I've worked with some families to boost the thymus gland during illness and help prevent ear infections from getting more infected by opening up the temporal bone and getting the fluids and things draining. I mean, adults will tell me, and you'll even see it as I'm working with a child, you'll see the nose start running and running and running.
Yeah, well, that's what Dr. Lindsay Sutherland alluded to, too, with chronic ear infection.
Mm-hmm.
She's like, maybe we need to do some craniosacral therapy. Maybe we need to do some chiropractic and pull that in to help. So that all makes so much sense. I knew I loved this modality, and now I'm just thinking of all the possibilities, all the ways that it can be so beneficial.
So I do know that there's a lot of different modalities out there, and what I've been told by some families is that the partner or the family felt craniosacral therapy was a better modality for them because it was so gentle.
Mm-hmm.
And they weren't afraid because, like, as I said, I typically work on the mom, the dad, the partner, the sister. When they're with me, they're usually there about 50 to 60 minutes. And the baby will let me know when they're done.
Mm-hmm.
The 2-year-old will let me know when they're done. They will wave bye-bye and walk to the door. And if they're there for an hour, I don't hesitate to take the other sibling and bring them up on the table and start playing with them and work on them, boost their immune system, or put mom on the table as the children play on the floor. So it's really, really nice.
Yeah, it's just an incredible tool. I know I keep saying that, but it really, really is. So if you had one pearl of wisdom, what would you like to share with families?
Trust your instincts when you feel something isn't right, even if this is your first baby. And sometimes it can be more than one baby that you've had. Maybe it's your third child and you're like, wait, why is this child so different? When we have our babies, I feel that birth of that mother comes out, and we have to trust our gut instinct, our intuition, and don't be afraid to advocate for your child and yourself. You are with that child 24 hours a day. Just because you go into an office and you see a practitioner for 10 or 15 minutes and, even though you have an idea, you've researched something, you've talked to someone, you should be heard. So you want to find the best practitioner that's going to listen to you and trust you as the mother of this child or as the parent of this child. So I guess my inner wisdom and approach is trust your natural instincts as long as they're to do no harm. If they're to harm the baby, harm the child, throw the child, no, we don't trust that.
Right.
We trust what we're born with, that inner wisdom that we have that says, I know they keep telling me they're fine, they're not. I know something is different with this child. And be that one, be that squeaky wheel, be that bear that's going to protect your cub. It's okay. It's okay to do that.
Absolutely. And it's so lovely to hear you say that, because all of my wonderful experts that I bring in, that is the recurrent theme. Mm-hmm. That's what I've been sharing too. That we can trust ourselves. It's gotten trained out of us somehow. Mm-hmm. We can learn to trust ourselves again and to trust our babies.
Mm-hmm. They communicate very loudly. Yeah. And I always love using the expression when they say, oh, this baby is so difficult. I said, no, they're just a communicator. They're going to let their needs be known. It's okay. Or this is a good baby. I say, oh no, all babies are good.
Yes.
All babies are great.
Yes.
But some just speak a little bit louder so that we notice it.
Right. Or some just have higher needs. They need to be rebalanced. There's something's going on or help rebalancing. But you're absolutely right. I love that you said that.
And listen, as the children get older, they really are in tune with their bodies, and also teach them how to become in tune with their bodies. That was always my favorite expression with my children when they were smaller. I'm like, listen to your body. If it says something needs to come out of it like a liquid, get to the right place to put it in. And they would. It was back then, as you know, I'm an RN, but, I was living in Boston, and we would use alternative herbs and all those great things. And I remember my 2-year-old walking around, Mommy, my ear hurts. Put that stuff in my juice that makes it better. 2 years old. She knew what she needed. It was echinacea. And we would put the drops in, and thank you, Mommy. That, to me, was pretty powerful, that it, too, we had taught her to know what her body needed.
Yeah, my daughter would get a lot of respiratory stuff, and she got to where by the time she was 4, if she felt like she was starting to have that phlegm and not feel well, she'd go, Mommy, I need my herbs, and she'd walk over to the refrigerator and get the proper dosage. She knew, but she was listening to her body, and it was so amazing to see.
Exactly. Again, I just thank you for inviting me, and I thank all the wonderful families that have entered my life the past 33 years. I truly, truly learned the most through them. I've learned a lot in education at my university, my webinars, my magazines, my journals, my books that I read. But I have to say, nowadays, my families teach me the most about what they need, what their child needs. So other practitioners, just listen to these families. They are smart. They're not trying to hurt their babies. And their children. They're only trying to bring wellness and harmony into their lives.
Yeah. So if someone wanted to find out more about your incredible work and they wanted to reach out to you, how could they do that?
Yes. I've been told if you just Google Annette Leary, it will come up. But I do have a website through the Upledger Institute. It's www.iahp.com/Annette-Leary. And I'm sure you'll have that on the site as well.
Yes, it'll be in the show notes. And then also a link to your Facebook page, if that's all right.
Yes, they can always message me at Annette Leary. I also have another page, Annette's Natural Approach to Health and Wellness. That's my other Facebook page.
Oh, wonderful.
So either Annette Leary or Annette's Natural Approach to Health and Wellness.
Wonderful, wonderful. Thank you so much for being here with me and sharing this incredible modality, because it really can help families. If your baby is crying all the time, there's something going on. And often people don't realize that there are these very complementary practices that can help.
That are very gentle.
Yes. And so there is help out there for you.
And we can teach you what to do when you're not with us. Yeah.
Yes.
Trust your instincts.
So thank you.
Thank you. Thank you for I think we've been friends for over 17 years. I moved here 17 years ago.
Yes. Thank you again. And thank you, families, for listening. And like all the guests have been saying, please trust yourself, trust your inner wisdom, trust your baby and your body, because they're all talking to you. You merely have to listen.
For more great conversations like these, or to find out more information and access Michelle's library of amazing guests, go to birtheasservices.com/podcast. For more information on the Birthease method, Michelle's classes, meditations, and other services, go to birtheasservices.com.